fact, hearing loss only affects older adults?
That is a myth. So there are really good measurements, procedures involved even with newborns. So right now when you're born, you would get a screening for hearing, which should happen before 1 month. And then if there is a concern for hearing loss, you would then go ahead and get a comprehensive test diagnosis by 3 months. And then by 6 months, it's encouraged to have a treatment plan, hearing aids, whatever is necessary to treat the hearing loss. So this is actually called the Au.D program, and this means that hearing loss can be diagnosed in someone as young as a couple months old and then also treated before 6 months of age. So it's not just a geriatric older diagnosis, it's something we see even when children are, weeks to months old. So not true.
Myth or fact, if I can hear, my hearing must be fine?
That is not true. So oftentimes, especially when we have hearing loss, we tend to see with sensorineural hearing loss, it's a gradual process. So oftentimes you don't really know that it's happening. So often we'll see patients come in and we'll do a test, comprehensive evaluation, and they'll say, wow, I didn't realize my hearing is as bad as it is. And a lot of this has to do with because it takes time for the brain to recognize, and it might not just be, everything's just really soft volume. It could just be primarily a clarity issue. So that is not true. I didn't say myth.
Myth or fact, hearing aids make everything sound loud and unnatural?
That is a myth. However, a really important factor is how your hearing aids are, one, prescribed, and how the audiologist behind the actual measurements and how the hearing aid is fit to you. So I find it very successful when we first get a patient, we are treating their hearing loss. When we first fit them, we tend to get all the perfect measurements, get as close as possible to something called real ear verification. With that said, oftentimes if you let a patient leave that first day with that loud level, which they perceive as loud, it's not going to be successful because the patient is, the ears are on board, but the brain takes time to process and get on board. So what I typically do is we'll actually set it to where it needs to be and then pull back from that. And then over time, it's a process. So we'll gradually increase to when the brain's ready to then take in that information. So more of a smoother process. So it can be true, but it shouldn't be true.
Myth or fact, earbuds are worse than over-the-ear headphones?
So I would consider that to be a fact because when you have the earphones over the ear, they're not as deep in your ear, so the sound's not quite as close to the eardrum. Also too, with the little earbuds, oftentimes when you put those in your ears consistently, a lot of people don't clean them, which can cause bacteria growth and then other issues, so possible risk of infection. But with the headphones, it's important too to consider headphones that have some level of noise reduction, so it prevents you from having to turn up the volume too. And a lot of headphones use something called active noise cancellation or called phase inversion, where that can make that possible.
Cool. Myth or fact, ringing in your ears is normal and nothing to worry about?
That's a myth. So when you have ringing in your ears, it's important to get that looked at by a medical professional, an audiologist. Why? Because there could be many reasons for that. For example, sometimes just with hearing loss, it can be a result of the hearing loss. However, sometimes it can be, even a fact of what medications you're taking. For example, high doses of aspirin can cause an increase in tinnitus, so maybe that's something that needs to be addressed. Additionally, hearing loss and tinnitus go hand in hand often because when we're not stimulating the brain properly, oftentimes the brain acknowledges that and then creates the signal it's missing, which can be tinnitus. So again, addressing this issue is important.
Myth or fact, you only need a hearing test if you notice a problem?
That's a myth. So it's important to get hearing testing, as I mentioned, around 30 to 40s to get a baseline. And if everything's great, get another reestablished baseline around 50s, again, because a lot of the research looks at that mid-age being an issue for hearing loss to increase and then being connected to that cognitive decline. So it is important to, even if you feel like you're hearing okay, to get a hearing baseline at least. And then, of course, if there's loss, follow up more regularly for that.
Myth or fact, hearing loss can impact brain health?
Yes, that is true. So there are connections between cognitive decline and hearing loss, and it is an independently associated factor and one of the highest modifiable risk factors preventing the cognitive decline. Even at a mild stage hearing loss, we're seeing more people than ever getting fit with hearing aids that are prescriptive earlier rather than later, again, to prevent that from happening quicker.
All right, last one. Myth or fact, hearing protection is only for concerts or construction sites?
That is a myth. So there's many different activities you can do that you will require some hearing protection. So an example of that is the following, but also too, I have people come in that maybe ride motorcycles or, concert going is one thing, construction use, but also anytime you're really exceeding that 85 to 90 decibel range consistently, you want to protect your hearing. So, and also too, if you're someone who is in a lot of those situations, often there is something called like a custom hearing protection that can actually be customized to your ear and then give you the ample protection without compromising sound quality as well.